This is the CPAP Shop's first webinar, and we're happy to have with us Dr. Brandon Peters, who is a neurology-trained sleep medicine specialist and has researched and written numerous articles and books, chapters concerning sleep-related habits. And we have a question that a lot of our customers have asked us: will sleep apnea ever go away? But I think before we discuss that, we want to touch on exactly a brief summary and understanding of what OSA is.
That's great. So obstructive sleep apnea is a very common condition in which the upper airway repeatedly collapses down during sleep. So if you imagine the airway extending from the tip of the nose to the top of the lungs, the soft tissues in the nose and the back of the throat can sometimes collapse down. And when that occurs, it leads to other consequences. So if it completely closes off, it's called apnea, which is from the Greek that means no breath. But if it's a partial collapse where there's still some air movement but not as much, then it's called a hypopnea. These events, by definition, last for at least 10 seconds. They may last even up to several minutes. And they occur at least 5 times an hour of sleep and maybe more than 100 times an hour in some individuals. Each event is associated either with a drop in the oxygen levels of the blood or with an awakening from a deep stage of sleep into a lighter stage of sleep or even to wakefulness. This repeated event where the oxygen level drops during the night is very stressful on the body, so there's an associated increase in blood pressure, heart rate, and also a burst of stress hormone, which is called cortisol. And that has some important consequences. The shifts in stages of sleep from deep sleep to lighter sleep is also associated with poor sleep quality and some daytime cognitive problems, as well as sleepiness and other concerns.
So if a person, I'm sorry.
Go ahead.
I was going to say, so if a person is diagnosed with sleep apnea, it's very important that they continue the therapy with the CPAP machine, even though we know it gets frustrating trying to adjust to this or obtain a mask that really does work well and creates a good seal for them.
Yeah, exactly. So certainly CPAP is one of our preferred treatments. And the reason we want to treat sleep apnea at all is not only are there sort of daytime symptoms, maybe you feel sleepy, you have some problems with concentration, attention. There's also associated mood issues like depression, anxiety, irritability. But there's also major health consequences. So sleep apnea is associated with high blood pressure, problems with diabetes, even hyperlipidemia or high cholesterol. It's been strongly associated with risk for developing heart attacks, strokes, and a lot of other serious health issues. So treating it with CPAP is definitely a preferred option.
So we have patients that, a lot of patients out there that can't, fathom being without their CPAP machine, even going as far as to purchasing a second CPAP machine outright, just in case something happens with theirs, or a lot of patients will purchase a secondary CPAP machine for travel purposes only. Understanding that how well a person feels after they have been introduced to the CPAP machine and are compliant, a lot of patients will still ask, is this ever going to go away? Is this something I've been genetically passed down to me? If through weight loss or breathing treatments, will my sleep apnea ever go away?
Yeah, so there does seem to be a strong genetic component to sleep apnea. It often runs in families, and if you think about it, family members often have what we call familial resemblance. They look like one another, and the anatomy of the airway is similar too. So if grandpa or your dad or your mom or whatever has sleep apnea, then the chance, if you look similar, that you may have sleep apnea as well. And it has to do with the structure of the nose or the nasal passage, the size of the tongue, the position of the lower jaw, especially if it's slightly smaller or recessed. That's where the tongue rests, and if it pushes back, the tongue is pushed back into the airway. And all of these things can contribute to the risk of having sleep apnea. There are specific genetic conditions that are strongly associated with sleep apnea, so something like Down syndrome, many of those individuals also have sleep apnea. Some people worry or wonder if really it's weight that's driving things for them, and being overweight or obese definitely can contribute to the development of sleep apnea or the worsening of sleep apnea. Fat not only fills our stomach, but it also lines our airways. So the airway is more narrow and more easily collapsed when we have excessive fat or adequate lines it. So usually we recommend that people may experience some benefit if they lose about 10% of their weight. But if you're significantly obese or morbidly obese, it may need to be even more than that. But a lot of people will have a weight loss and then have their condition reassessed with another sleep study just to see if they still have sleep apnea and how severe it is. Often it can get better. Some people can even come off CPAP, but many people still require at least some level of CPAP treatment, perhaps at lower pressures if they do lose the weight.
So a person, there is no, it's not the right answer for everyone. For some people, they might, through weight loss and a lifestyle change, stress change, might be able to get off the CPAP machine, and other people, even through weight loss, might still need a CPAP machine, but might enjoy a lower pressure, which of course makes the therapy a little bit more easier to tolerate.
Yeah, exactly. So people who have mild or moderate sleep apnea can sometimes investigate other treatment options like oral appliances and that sort of thing. But the nice thing about CPAP is it works. It's been really the gold standard treatment for sleep apnea since the early 1980s. It'll wear the obstructions in the nose, the throat, the base of the tongue. It'll buffet those tissues away, open up the airway, and it's very effective. Not a lot of side effects associated with it. Technology has improved substantially in the last 15 to 20 years, so the machines are much smaller, quieter, there's better humidification, included heated tubing, and although compliance is an issue for some people early, if you address the problems with interventions, most people can tolerate it very well, and it helps pretty much everyone with sleep apnea.
So is surgery a viable option for people, or that would be something that would be assessed on a case-by-case basis?
Yeah, it definitely depends on your anatomy. I mean, if there's tissue that can be moved or removed to improve the airflow through the nose and the mouth, then surgery can be an option. The effectiveness of surgery really depends on where the site of obstruction is, and some procedures really only partially address the problem. Surgery is most recommended for children who have large tonsils or adenoids that are surgically removed, and they'll have a significant improvement. Allergies can certainly cause tissue enlargement, especially within the nose, and removal of that with something called radiofrequency ablation can sometimes be helpful. If you have a deviated septum, which is the midline structure of the nose, if that's moved to one side, straightening that out with septoplasty can also be used for surgery. Some people have had soft tissue surgeries. The most common in recent past was something called the UPPP, or the uvulo-palatal pharyngoplasty, and that's removal of the tonsils, the uvula, and some of the soft palate. That's a painful procedure, it's often a bloody procedure, and it's not entirely effective. People who have those sorts of surgeries, about half of them will show a 50% improvement, which means that many are still left with residual sleep apnea that requires treatment with either CPAP or even with therapies. The most effective surgery is actually a major jaw surgery. It's called MMA, or maxillomandibular advancement, and the upper and lower jaw is surgically broken and then moved forward. It's fixed in place with titanium plates and screws, and can change your facial profile. It may result in some numbness on the jawline, and recovery can take several months. Most people don't opt for that surgery, but again, it's about 80% effective, so it does work well for the people that do decide to do that.
Yeah, we have had a lot of customers that have been working with us over the years and have a CPAP machine, have had the surgery and still on a CPAP machine, but most of the time they are at least able to take advantage of a much lower pressure, where it makes using the mask, they don't have to have it on so tight. But of course, as you described, and is exactly what they said, it was a very painful surgery that recovery was not. It was much longer than they expected, and they would have thought twice about it.
Yeah, and that's the experience of my patients as well. It may help some, but if you're going to end up using CPAP anyway, some people just opt to avoid all that.
Okay, so I want to thank you very much for joining us today, and Dr. Brandon Peters, great insight and a much better understanding of sleep apnea, the summary of sleep apnea, what it is about, how surgery can definitely help, but of course it's a case-by-case basis that you would want to speak with your doctor about. Will sleep apnea ever go away? It is, of course, different for everyone, and significant weight loss, taking supplements, breathing techniques, aging, all of these things combined will maybe not allow you to be without your CPAP machine, but probably have a much better time with it for compliance and for therapy.
Yeah, exactly. And I encourage, if anyone wants more information, welcome to check out my website, which is sleepdisorders.about.com. And I encourage everyone to speak with their local sleep specialist to get a more personal assessment of their own individual needs and what options might be available.
Well, thank you very much for joining us today. We're going to have many more webinars where we'll discuss recent and the most important questions about sleep. We reach out to our customers consistently and ask them, the things that they'd most like to talk about, whether it be, will my sleep apnea ever go away, or certain breathing techniques, or what exactly is an automatic CPAP machine. We'll be sure to discuss all of these topics, and if there's any questions for myself or for the doctor, this broadcast will be published on our YouTube channel, and we will be happy to address any concerns or questions that you have.
Thank you.
Thank you very much. This is Chris from the CPAP shop, and thank you very much, Dr. Peters, for joining us today.
You're welcome. My pleasure.
Have a good day.